Hi, good morning. I'm Florina Colar, and I would like to give you a short analysis of the panic disorders and current treatments that help us as clinicians. As we know, panic disorders is characterized by sudden intense episodes of fear. Most of the time it's accompanied by pronounced physical symptoms, and these symptoms arise within multiple physiological systems and arise from dysregulation. Panic attacks involves hyper activation of the brain regions such as the amygdala, which is a process which process fears and most of the time inadequate modulation by the cortical structures. Also, the sympathetic nervous system is primarily responsible for the response that we call fight or flight response. When activated, the SNS increase the rate, the blood pressure goes up for most of individuals' respiratory rate, and this is a signal that prepares the body for immediate action. This is a common physiological change observed during panic attacks. As we know, the parasympathetic system and the sympathetic systems also responds, right? So the PNS restores the homeostasis by promoting rest and digest functions. This imbalance, where the PNS falls to counteract the CNS hyperactivity, has been linked to persistence and intensity of panic symptoms, according to Lodge, Shin, and Shelps, those authors that I'm naming here. I would like to talk about the physiological process in the panic disorders. As we know, serotonin imbalance is central to the disorder. The primary inhibitory neurotransmitter known as GABA is reduced. His reduced function has been implied to practically heighten the neural excitability and the panic symptoms. A decrease of the GABA energetic activity correlates with anxiety disorders, and during the panic attacks, increased secretion of catecholamines via the SNS intensifies those physical symptoms, which most of the time come with palpitation, sweating, and tremor. Again, as part of the physiological processes that are part of the panic disorders, I would like to talk about the dopamine level, who's involved in motivation and reward pathways. Altered dopaminergic activity may influence the onset of panic and anxiety symptoms, particularly regarding the antic. In the panic episode, we know the sympathetic nervous system triggers physiological changes, as I stated before, such as heart rate, rapid breathing. Those are actually mobilizing the individual to either confront or fight or escape the common symptomatology. When those are dysregulated, this mechanism can result in panic attacks, and most of the authors are talking about this common mechanism that is involved in panic disorders. We know what is the cause of the panic disorder. We know there is a genetic predisposition, the neurobiological abnormalities like early life stress and the chronic exposure to traumatic events such as war or any other type of traumatic events. And most of the studies show that the hyperactivation of the amygdala, which is a key brain function involved in the fear and poor regulation by the prefrontal cortex, contributes to panic symptomatology. This comes in combo with a lot of comorbidities, including major depressive disorder, generalized anxiety disorder, and as I stated before, the PTSD, and most of the times the substance use disorders. The panic disorders can lead to significant functional impairment, including agoraphobia, where individuals fear situations that might trigger panic and become avoidant of public spaces. The current treatment, the first type of treatment that I'd like to talk about is the CBT, because this particularly treatment incorporates interoceptive exposure. It's a technique designed to reduce the fear of physical sensations associated with panic. And the CBT works helping patients reframe catastrophic thinking and gradually expose themselves to fear stimuli to reduce the avoidance behavior. So it's practically a way of acknowledging and being and accepting some of the stimuli. Mindfulness-based intervention, psychoeducation, and relaxation techniques have shown to help individuals regulate emotional responses, according to Stein and Rothenbaum in 2007. Other treatments are pharmacological treatments, often include selective serotonin, and those can help regulate the serotogenic pathways and reduce the panic frequency. Benzodiazepines might be prescribed for short term, according to the authors, but generally avoided for the long term. I would like to actually, based on my input from my teacher, I would like to talk about the cultural and physiological perspective. The panic disorders arise from a complex physiological mechanism, while also being shaped by indeed cultural interpretations and experiences. Understanding both the biological and the cultural dimension of panic can lead to more effective inclusive treatments. So, for example, in some cultures, where individuals are perceived, or different when experiencing mental health symptoms. As an example here, the Latin American cultures, when panic symptoms occur, those are identified as ataque de nervios, often triggered by the family stress, marked by uncontrolled crying, trembling, and aggression. In Cambodian culture, the panic symptoms might be considered Kial attacks caused by the belief that wind rises of the body in the body. Some culture-specific symptoms highlight the need for clinicians to understand those cultural items and distress to avoid misdiagnosis. Again, we know that a panic disorder involves dysregulation in several neurochemical systems, and those imbalances in the serotonin level may link to anxiety and mood regulation. During a panic attack, the body also releases catecholamines like adrenaline and noradrenaline, escalating those physical symptoms. And the cortisol, which is a stress hormone released through the HPA axis, is frequently elevated in those individuals with chronic anxiety and panic disorder. Once again, the cultural stressors such as discrimination